All right, Dr. Kevin Kavanagh is joining us right now. Good morning, sir.
Good morning, Jack.
How are you today?
Very good.
Did we learn anything new over the weekend regarding the coronavirus?
Well, things are still progressing, which is unfortunate, but there's a new strategy called pool testing, which I think is very interesting and could be very useful even in Kentucky.
Please tell us.
Well, pool strategy is where instead of doing a single test on a single person, you take a number of specimens, anywhere between 3 to 50, but a lot of times it's around 10, and just test that pool of specimens. So you're only doing one test. And if it is negative, all is well. If it's positive, then you have to go back and test each one individually. And of course, how many you test depends upon how much virus there is in the community. The more the virus, the less the size of the pool. There is some downsides to this, is that if you have very low levels of virus, it may get diluted out in the pool and not be positive. But this has been used very, very successfully in both Singapore and Germany, and I think would be a very good strategy for opening up nursing homes. In other words, before families visit the residents, they are pool tested. I think this would be very important. It could also be used in factories and in warehouses, and you can do this almost daily. So things in Kentucky haven't gotten much better since we started this, but it hasn't gotten worse. We've been flat, we've been at a low level compared to other states, but still the virus hasn't changed. So when we open up nursing homes, personally, I'd like to see families pool tested in addition to the advisements that have been given.
I read a couple of days ago that the nursing facilities are going to be allowed to open on the 15th of July for visitors with a whole bunch of restrictions. Now, that doesn't mean they have to open, or does it?
I don't believe so. I would be very surprised if they said to nursing homes, you have to only do this and you have to do it. I think that is the minimum standard, and I think not opening is still an option. One of the things that is very difficult for me to grasp, because it's so unusual, that once a virus gets into a nursing home, it is very difficult to stop. And this has to do with the asymptomatic spread. This is very, very unusual with any type of viral infection. Usually you do not have 40 to 45% of the people carrying the virus can spread it and they don't even know they have it. So this is a very tough situation to reverse. And I think pool testing gives us our best chance of doing that.
Well, my mother is in a nursing home here, and I haven't been able to see her except through the window a few times for 3 months now, and I would just absolutely love to see her, but I would not love to see her at the risk of that happening. And I'm really hoping that her facility doesn't open on the 15th. I think it's too early.
Well, and I kind of do too. As I said, the virus hasn't changed in Kentucky. I mean, that's good and bad news. We haven't driven it down to close to zero, but on the other hand, we're not skyrocketing in rates either. We still need to be very careful. We need to wear masks. Hopefully we don't have a bunch of doubters that are still calling in now. Vice President Pence has gone on record to saying that you need to wear masks. Mitch McConnell has been very strong on this subject to wear masks. And of course, the governors of Arizona and Texas have advised people to not only wear masks, but also to stay indoors because the rates there are skyrocketing. This is extremely important to do.
Let's talk about what was on 60 Minutes. Was that last night on the antibody test?
Yes. And we've talked about that before on this show.
Tell us a little bit about it for those of you who maybe saw that and want a little more information.
Well, they basically said that the FDA, because we didn't have much testing in the United States, they opened up the floodgates by not reviewing the tests themselves and evaluating them, and they suspended their regulations and allowed manufacturers just to basically state, oh, the test works, and then they could be marketed. And this resulted in a large flooding of tests into the market, hundreds of different types of tests. And the United States had pinned their hopes on these antibody tests to allow people that were immune to go into work, But unfortunately, the CDC found, as did agencies in Europe, that over 50% of the positives of these tests were actually negative. They were false positives. And so this was a very dangerous situation. We had a whole strategy of reopening that basically didn't work because of this. And I should add that all of this traces back to the decision of using the CDC test, which wasn't even developed yet, to have the CDC develop one, as opposed to using the WHO test, which was developed in Germany. And that's what was so successfully used in many other nations. So we had a lot of missteps on testing, and unfortunately, we're not out of the woods at this point.
The president had that first big rally a couple of weeks ago in Arizona, right? Was it Arizona where he had the?
It was Oklahoma.
Oklahoma,
Yeah.
then Arizona, yeah, Oklahoma.
Or Oklahoma, then Arizona.
Yeah, and that's been long enough now that I think we would be hearing if there were a lot of people who tested positive who attended that. Is there any information that you know of about that?
Not any information, unfortunately. I do know that they had some people who were working on the campaign along with Secret Service that tested positive, but this I think was either before or right during the rally. Afterwards, we don't. I mean, it right now is even very hard to get hospitalization data from the states of Texas and Florida. So there's a lot of not sharing of data, which again inhibits our ability to respond to this epidemic. All this needs to be very, very transparent.
All right, well, we will speak with you again on Wednesday morning, and thank you as always.
Okay, thank you very much, sir.
Dr. Kevin Kavanagh, he is a retired physician and also a founder of a national group called Health Watch USA.